Thank you for joining us here today. My name is Dr. Susan Phillip, PHILIP. I'm the health officer for San Francisco and the director of the Population Health Division here at the San Francisco Department of Public Health. This week, the San Francisco Department of Public Health announced that all San Franciscans 6 months and older are urged to receive a new COVID-19 vaccine aligning with the Centers for Disease Control and Prevention recommendations. On Monday, September 11th, the Food and Drug Administration approved and authorized the updated COVID-19 vaccines by Pfizer, BioNTech, and Moderna. The new vaccines are expected to begin arriving next week. COVID-19 will remain with us for the foreseeable future, but we have many tools to slow the spread of the virus and prevent severe illness and hospitalizations. The new COVID-19 vaccines provide the best available protection against severe disease caused by current variants and will be an essential tool to help San Franciscans stay healthy. Over the last 3 years, San Francisco has led the nation in its response to COVID-19, which would not have been possible without the partnerships with community-based organizations throughout the city. These partnerships helped San Francisco achieve one of the lowest pandemic-associated death rates of any metropolitan area in the United States. We San Franciscans can build on our excellent track record of COVID-19 prevention by receiving the updated vaccines. These vaccines work, they are safe and part of a trustworthy medical system. A new COVID-19 vaccine is recommended if one has not been received in the past 2 months. As the COVID pandemic continues into a third flu season as well, San Franciscans can do their part to help reduce strain on their hospitals by getting a flu shot. All San Franciscans aged 6 months of age and older are urged to get vaccinated this fall against both COVID-19 and the flu. COVID-19 and flu vaccines can be given at the same visit. A flu shot is recommended for every season. Flu vaccine prevents millions of illnesses, hundreds of thousands of hospitalizations, and thousands of deaths each year. Getting vaccinated may also protect the people around you, including those who are more vulnerable to serious illness, like babies and young children, older people, and people with certain chronic health conditions. COVID-19 vaccines will be available at healthcare providers, pharmacies, and clinics. San Franciscans should first go to their healthcare providers for COVID-19 and flu vaccines. As the COVID-19 landscape continues to change, our commitment to communities most impacted by the virus stands firm. The Department of Public Health is committed to ensuring low barrier access to vaccines and will continue to partner with community organizations in priority neighborhoods to offer information and vaccines. Starting next week, the Department of Public Health will offer vaccinations to individuals without health insurance or who face barriers to accessing vaccination. Vaccine operations will include neighborhood sites, pop-up clinics, and mobile vaccination. While vaccines can reduce the risks of contracting COVID-19 and the flu, they do not completely eliminate them. The Department of Public Health strongly recommends that San Franciscans take additional actions to protect themselves and others this fall and winter from illness, including staying home when we're sick and staying away from others who are sick, practicing good hygiene by washing hands, covering coughs and sneezes, and avoiding touching our nose, eyes, and mouth as much as possible, keeping a well-fitting mask on hand for added protection in crowded indoor spaces, having COVID-19 tests at home to identify infections so we can protect ourselves and others, increasing ventilation or air filtration when indoors if possible, and if you do come down with COVID-19 or the flu, ask your doctor for prescription medication to treat it. These medicines should be started as soon as possible after you start feeling sick. We remain committed to ensuring lower barrier COVID-19 resources are available to communities most in need, both by working with our health system partners and pharmacies, and also by providing ongoing service with a focus on equity. We're now happy to answer any questions that you may have about these topics. And I would like to introduce Dr. George Hahn, our Director of Communicable Disease Control and Prevention here at the San Francisco Department of Public Health.
It seems like the general public has gone from fear, originally, to prevention and then to where it feels like we are now, and that's fatigue when it comes to this virus. What's the message to the general public that this is still something that needs to be on their radar?
I think the message is exactly what you said. The virus is still here. We are really fortunate that it is no longer the threat that it was 3 years ago in the earliest stages of the pandemic. We now have tools that help protect people and allow us to go on with our life and to be together in ways, but we don't want to ignore the fact that we continue to have the virus among us, and we want to make sure that people understand that these updated vaccines are a key way to prevent the most serious outcomes that could still happen from COVID-19. And the vaccines are also effective against preventing long COVID as well. So people do get vaccinated. The vaccines have been shown to decrease those risks, even if they don't eliminate them entirely. So there are many reasons why we should pay attention and follow recommendations for this updated COVID-19 vaccine, just as we think about the flu every year. So that is the message that I would have for San Franciscans. And we've done such a great job up until now. I have full confidence that San Francisco will respond again and get these vaccines to continue improving their health.
Is there a priority as far as who should be getting shots? In any sort of order, like previously, of course, it was the most vulnerable, and then kind of working way back. As now, it's just pretty much if you can get an appointment, go ahead and get your shot.
Yes, we highly recommend that everyone ages 6 months and older receive the COVID-19 shot, as well as the flu shot this year. And there's a reason that the CDC has made a universal recommendation, and that's really to make it easier for everyone to get vaccinated. Of course, if you are older or have certain medical problems, you definitely want to be doubly sure to get vaccinated. But really, these vaccines are for everyone.
Do you expect supply shortage, plenty of supply? How are we looking with regards to available vaccine?
Supply is not anticipated to be a problem this year, and so we expect to have plenty of vaccine for everyone who needs it, and so we highly encourage everyone to go out and get vaccinated this year.
Quick follow-up, how many clinics for those uninsured should we expect to see in the county? Thank you.
Yeah, so the question is about uninsured patients and how many clinics we would expect to carry vaccine for them. And I believe it should be well over a dozen clinics and pharmacies, especially retail pharmacies, participating in the federal government program to provide free vaccine for uninsured individuals.
And for clarification, that goes to the end of the year and the federal program?
The federal program for uninsured adults goes until December 2024.
Other questions?
I think okay then.
Everyone's good? Okay, thank you everyone.
Thank you so much.
That concludes our press conference.